Welcome to the voiceover video on the appendicular skeleton. So now we will be focusing on the upper and lower limbs and the structures that attach each of these to the body trunk. For the upper limbs, these are especially the scapula and clavicle, while for the lower limbs, it's the hips. And these junctions of limbs are known as girdles. And we will be starting with the pectoral girdle, so looking at the shoulder. So I think it is a good idea that we talk a bit about the bones involved. And these would be, of course, the scapula and clavicle. Note that the humerus really is not considered as being part of this, but I have included it as it is so closely attached to what we will be looking at. And then if we are considering the function of the shoulder, well, it is to attach the upper limb and axial skeleton, as well as to provide muscle attachment sites, as we have seen with the earlier parts of this chapter. So what I want to start with is to consider a bit of physiology, as it will help us to understand the anatomy of the shoulder joint. Therefore, I would like you to consider the possible movements that the shoulder joint allows us to do. And if you wish, this is an excellent chance for revision of the movements. Remember flexion, extension, hyperextension, abduction, adduction, circumduction, and so on. So we will end up concluding that the range of movements allowed by this joint are especially huge. So the next logical question is, why? So let's remind ourselves of our evolutionary origins. So when we moved from being four-legged animals and started walking on 2 feet, we released our upper limbs from doing other things. And this includes the ability to manipulate objects and so on. How would we make this possible? And by this I mean such an amazingly large range of movement. Well, it comes down to the proportions of the two parts that articulate here. So, the humerus has a very large ball-like head, while the socket formed by the scapula is relatively small. This is known as our glenohumeral joint. The name refers to the glenoid fossa of the scapula and the head of humerus. And it is characterized by this ball and socket arrangement where the size of a ball far exceeds that of the socket. And therefore it has a huge amount of motility. But it comes at a cost. Sacrifice stability. The shoulder can be easily dislocated. And this often happens in contact sports such as rugby. I am going to warn you here in case anyone is squeamish, as I have some pictures of dislocated shoulders to follow. And positioning them back is something that requires some force and skill. This is not just a little boo-boo because of the potential risk for the nerves and various vessels, so we really would rather not have that happening. If you look here, these are pretty striking pictures. It is obvious that the glenohumeral joint has failed to stay in place. Let's look at some X-rays. The X-ray on the left shows a normal glenohumeral joint, while the one on the right shows one that is dislocated. So we need a bunch of muscles like our rotator cuff and some ligaments to stabilize this poor bony fit. I also want to point out another joint here, and this is called sternoclavicular, as it brings the proximal end of the clavicle together with the manubrium of the sternum. Please note that the scapula is not directly attached to the ribs, but held in place by the muscles, and this clavicle, which is the only bony junction that attaches it to the axial skeleton. So let's look at the bones involved in more detail. Clavicle, which is commonly known as our collarbone, is this S-shaped bone if we look at it from the top down. And this is a perfect time to highlight that it will not be enough for us just to know the names of the bones, but we need to know also parts of them. And clavicle would have a proximal or medial end which articulates with the manubrium of the sternum. And then we have the distal or lateral end which articulates with the acromial process of the scapula. So you might ask, what is the function of clavicle? Well, many muscles anchor to it. For example, the ones holding scapula. And it also transmits forces to and from the upper limb. In fact, this is why it is easy to break your clavicle when you try to catch yourself when falling down. The clavicle would be the weakest point of this transmission of forces and snap consequently. Let's look at scapula next. Here we have anterior aspect of scapula, which is of course often known as our shoulder blade. And again, we need to identify certain parts of it. Let's start with the borders that it has. At the top, superior border. On the side, lateral border. And close to the midline of the body, medial border. We have also mentioned earlier the glenoid cavity, which was our socket of this joint that we were looking at. Let's flip this around and look at the posterior aspect of the scapula. Here we see many structures worth of noting. Notice the spine of the scapula. It really shows up as a ridge running through it. And this will be important for us in a few moments as we will discuss structures as superior or inferior to it. We also have the acromion to which the clavicle attached to. This is the most lateral projection. And coracoid process, this is the projection on the anterior side. For example, biceps muscle attached to this. And then we have suprascapular notch at the superior border. This is important for nerves to pass, for example. Let's think of the word fossa. It means some kind of an area of depression that is obvious. So here we have fossa above and below the spine. So supraspinous and infraspinous fossa. And if we return back to the anterior side, we have also subscapular fossa. Think of it. It makes sense as a term. Okay, I think that this is enough about the scapula. Let's look at the upper limb. There are 30 bones involved here, with wrist and the hand making up most of these. In fact, 27 of these. So the first bone proximally, when we leave from the scapula, is the humerus. Here we see the humerus of the right arm, both from the anterior side on the left of the screen and from the posterior side on the right. Before we get started, want to hear an anatomist joke? How about that? Okay, so the humerus has as well certain parts that we want to highlight. So we have the head of humerus at the proximal end. It articulates with the glenoid cavity of the scapula. And then we have greater tubercle and lesser tubercle. These are big bumps at the lateral distal end, with the greater being bigger and lesser smaller in size. Many rotator cuff muscles attached to these. And then we have also anatomical neck, which separates the head from the rest, and a surgical neck where the fractures usually happen. As an anatomist, I am tempted to say that the fact that we use these two terms is due to the surgeon's lack of knowledge of anatomy. Let's continue a bit further down. We have here deltoid tuberosity, approximately halfway down the shaft. This is where the deltoid muscle attaches to, as it wraps around the shoulder. And we have radial groove on the posterior side. Radial nerve runs here. Now we shall move to the distal end. Here we have trochlea at the middle of this end, and epicondyles as the most medial and lateral parts. Again, these are important muscle attachment sites. And finally, capitulum at the anterior lateral side. The last structure that I want to highlight here is the term fossa. Remember, these were areas of depression. And as we see in this figure, elbow is actually a very complex joint. This is because it is in truth many joints put together. We will study it in more detail a bit later. So we can just move down to the forearm. Let's start with ulna. This is the medial of the two forearms bones. And see, this is why you needed to learn about the anatomical position. Again, on the left we have anterior view and on the right we have posterior view. So at the proximal end, we have few parts that you need to know. Olecranon process grabs the trochlea of humerus on the posterior side. It looks a little like this cup-like structure. We also have coronoid process, which also contributes to this articulation with the trochlea of humerus. We also have radial notch, where ulna and radius articulate. And same thing at the distal end. Let's look at the radius. And again, remember that this is in an anatomical position. So a good mnemonic for it is when you put your thumb up for right on. And R matches with the R for radius on that side. For radius, I would like you to know the head, which articulates both with the humerus and ulna. And also radial tuberosity, which is this little bump. It is important for where bicep muscles attach to. And that will do for radius. Let's look at the hand. Here we have a right hand with anterior view on the left and posterior view on the right. And here we have the 8 carpal bones that make the wrist. So scapoid, lunate, triquetrum, pisiform. And then trapezium, trapezoid, capitate, and hamate. Easiest way to remember them is to make up some riddle. I will not share what I use because it is a bit rude, but you can Google some ones if you wish. And then we have metacarpals that make the palm. 5 of these bones number from the thumb to the little finger. And finally phalanges, which are our fingers. These are 14 bones, with pollex being the thumb and all others digits. For fingers, 2 to 5. So, that is our upper limb. Now we are ready to move on to talk about the hips and the lower limbs. And on that note, there are some really strange products out there in Japan, including airbags for hips. How about that? Let's talk about the hips. They are made of 3 different hip bones and the sacrum. You learned about the sacrum with the vertebral column. So the 3 hip bones are ilium, which is the most superior one, ischium, which is the posterior and inferior, and pubis anteriorly. One of my students explained it as where your pubes are. Let's look at a few other structures that we need to know. Here we have acetabulum, which is the socket where the head of the femur joins to from our hip joint. And we have body of ilium, the largest part. And then we have iliac crest. This is the superior margin of the hip. And of course the opening. The baby's head is going to pass through here, and the shape of this will help us to define if the hip that we are looking at is a male or female. And pubic symphysis, you learned about this cartilage earlier. This is what opened when a woman was ready to deliver the baby, and the 2 sides of the hip separated. And we have pubic angle. This again helps us in telling if the hips are more male or female in terms of their characteristics. So a lot to see here. There are 2 more that I can think to show here. Greater and lesser sciatic notch on the posterior side as seen on this side view. So that completes our study of the hips. Let's have a look at the lower limb. And we will start with the femur. This is the only bone of the thigh. It is also the strongest and longest bone in the body. There are a few parts that I want us to know. The head is a part that articulates with the acetabulum of the hip. The neck is the part that is often fractured. And then we have major muscle attachment sites, the greater and lesser trochanters. More distally on the femur, we have epicondyles and condyles, which are again muscle attachment sites laterally and medially. And we have this fossa between the condyles. And then on the anterior side, the site for the patella to articulate at too. This is our femur. Let's look at the leg part. This is from the right leg and an anterior view. Notice how it is tibia that carries all the weight from the femur to the foot, while fibula is on the lateral aspect. And again, the language follows what we have learned before. We have medial and lateral condyles. And of course, tibia and fibula articulate against themselves too. For the fibula, notice the head and lateral bumps. So from these, our big take-home message was that it is the tibia that carries the weight. Finally, let's look at the foot. And now we are looking downwards onto the right foot. We have tarsals, which contain 7 bones. And again, one has to memorize them just like it was with the wrist. And we have metatarsals. These are 5 bones. And finally, a group of 14 bones, which are the phalanges. So our toes. Remember, hallux was the word for the big toe. And that is our foot. Now, this has been a lot of bones to cover. Many of my students tell that they benefit from looking at the model or diagrams, or of course, you can do anything that helps you to take the time to look at each of these bones and specific structures of them. So, this is the end of our final voiceover video for this chapter. I know that it has been a lot that we went through, but I have every trust in you tackling them. Well done, and thanks again for joining me.